start off first with some remarks by the NEMO director, and then we'll follow through with the rest of the panel. Mrs. Joseph, just
Thank you
from
very
your
much.
point of view.
Thank you very much, Richmond. Good afternoon, everyone, and welcome. The National Emergency Management Organization sympathizes with the families of all those who were involved in the unfortunate incident yesterday afternoon. I need to indicate that the mandate of the NEMO is hinged on two main pillars. One that speaks to preparedness and the other speaks to into sharp focus yesterday afternoon with this incident. We received a call at about 5:37 p.m. from the police indicating that there had been some activity, some explosion at the Cul De Sac area. We immediately proceeded to inform the relevant response personnel as per the plan, mass casualty plan. We immediately tried to reach the office of the Prime Minister, which is our first line of focus. We need to inform the Prime Minister of what has been reported to us. And then we proceeded to touch base with the fire chief, the chief medical officer, as well as our partners within the Red Cross fraternity. Having done this, we then, of course, responded to a number of calls that came in to the agency, as many persons were reporting that a quake had been felt. Persons felt it was an earthquake, and were reporting to us from various parts of the island. We were able to confirm with the fire chief that an appliance and personnel had been dispatched immediately upon the call to the fire station. So, having called the fire station, we were informed that a caller had previously been placed to the fire station and they had already been dispatched to the scene. We were not able at the time to get definite figures, but we did know that there were potential casualties at the time, and we informed the cabinet secretary of that. We were also able to discuss with our partners who were already calling based on what was out there via social media. So Sidima had already touched base with us in wanting an indication of what has happened, as well as PAHO. We were able to say that based on what the report that we got, that there seemed to have been an incident that the fire service and the police have responded to. Response agencies based on their needs, on their requirements, and we continue to do so at this time. We have provided the first situation report. As you know, that once there's an incident, we provide updates and situation reports to the Prime Minister, and that is shared with our partners as well. So we have done that first report, and that report is really based on reports coming in from the responders on the scene, the fire service, the police, as well as the medical team. So what is contained in these reports will actually be discussed by the entities present here today.
And with that, we go to the first persons on the scene, which was the fire service. So, Mr. Joseph, over to you.
Yes, good afternoon to all. Let me follow the lead of the NEMO director in extending condolences to the families of the deceased. At 17:34 yesterday, 5:34 p.m. yesterday, we received a call from an anonymous caller stating that there was an explosion at Renault's construction. The explosion was reportedly felt and heard at our fire service headquarters. We responded immediately with two fire appliances along with an ambulance. We had on board a crew of 6 persons initially. Upon approaching the scene, they reported seeing a plume of smoke, or what appeared to be smoke or dust. As they approached, persons were fleeing the scene. A number of vehicles were reported to have some injured persons on board, and were taking them towards the hospital. When we got to the scene, we found vital signs. So in a sense, the transport any casualty to the hospital. All those persons were already transported when we got to the scene. We did, however, have to attend to a fire. We were told that that was as a result of the blast that was involving an excavator and what appeared to be another piece of heavy equipment. We did a preliminary search of the facility. It's a pretty wide area. And following the extinguishment of the fire, we did a second research. But both of those searches did not reveal any further casualties. We waited until the Dr. King came across and pronounced the persons dead, after which we left the scene. Our fire investigators are now conducting investigations along with the police.
Okay, so Dr. Stephen King was the medical doctor who actually
pronounced.
There we segue directly to the acting commissioner, Mr. Daisy, from your perspective, and give us a summary of what transpired between yesterday and today.
Good afternoon all. Welcome. Yes, yesterday about 5 p.m. we received a report of what appeared to be an explosion down at Cul De Sac. Police officers were dispatched. We dispatched various teams. We had SSU dispatched. We had major crimes, CID, scenes of crime, we call the investigators. Also, we had EOD, which is the explosive ordnance disposal team. These teams responded to that scene. Upon arrival, actually, I was present also. We met with fire service, who was already in attendance. We joined forces with them, where a search was conducted because lives is the most important thing at the time. So we searched whether there were any lives and so on, or even bodies. But that we found 2 bodies on the scene. Yet we called for assistance. The forensic officers called for the assistance of Dr. King, who immediately came. He was coming from the south of the island. He came, and with his assistance, they were able to retrieve some evidence for testing on the scene. Actually, the scene, I would say it was a disturbed scene with materials all over. So with the help of Dr. King, the scenes of crime officers were able to collect important material which they believe would assist in the investigation. The darkness, so we did what we could have done for the night, and the scene was secured until this morning, where the officers returned about 8 a.m. SSU and patrol officers assisted in providing security until the officers returned on the scene this morning. But at all evidence collected on the scene will be tested, some of which as early as tomorrow will be forwarded to Tulsa in Oklahoma in a lab where we are hoping to partner with, and so that we will get results.
So from there, obviously, as Mr. Joseph has indicated, all of the persons initially were transported via private vehicles. Private means not the ambulance, and received at the Victoria Hospital. So from there we go into Dr. Frederick as to how your staff and the medical team were able to cope and deal with this incident.
Yes, so on behalf of the Ministry of Health, I'd also like to extend sincere condolences to the families and friends of those whose lives were lost, and also those who are actually in care right now, because there are persons still in a critical condition as a result of this event. As NEMO Director indicated, we were alerted to this event by the NEMO Director at around sometime after 5. And as soon as we got the note, we placed our whole health system on alert. So that involves informing the PS, Minister, activating Victoria Hospital, the Victoria Hospital management team, whilst speaking to community services, because we have the primary care services and St. Jude, so that they can come in to assist as needed. So Victoria Hospital got on board very quickly, and by the time we, as I indicated, by the time we got the news, very shortly after, the emergency room started to realize that persons were coming in, you know, in various degrees of distress, obviously, you know, blood around, etc. So persons were indeed coming in from early. So the whole team came on board, and we definitely like to commend the entire health team in terms of their response. Victoria Hospital activated all of its staff, its medical staff, its non-medical staff. Persons who were on the compound remained, persons who were off compound came in, and we had a significant number of community doctors and nurses who actually went into the emergency room. Tapia Hospital assisted as well. So by last night, maybe sometime after midnight thereabout, Victoria Hospital had seen a total number of 21 persons who had been involved in the incident. And of these 21, 3 were, well, 3 had passed. 1 died at the facility, and as you heard, 2 others died at the scene. In addition to that, quite a number of patients were in critical condition. And as a result, through the Office of the Prime Minister, urgent measures, and I believe NEMO as well, urgent contact had to be made with the team from Martinique, and the Martinique, I think it was a French Army helicopter, which actually came to evacuate patients. So during the night, up until about 5 a.m., we moved over about 4 highly critically injured patients to Martinique. And up to about half an hour ago, we had reports from Martinique that the patients are there, they are alive, and they're being cared for. 4 patients are being cared for in Martinique. Persons also needed major surgery, so all of the surgeons had to be out last night. And right now, there are 4 patients that are in Victoria Hospital, serious but stable, being managed after major surgical intervention. Most of the other persons have been treated and discharged to the outpatient clinic. But in addition to that, this morning, say around 9:10, up to around that time, Victoria Hospital has continued to see persons who are walking in, persons who indicated that they were at the site, but they were not severely injured, but they do have some cuts and bruises, etc., from the shrapnel or whatever it is that was flying about. So up until before noon, we had seen 9 additional walk-ins, and just before I came on board, I called again, and this afternoon they actually saw an additional 4 persons coming in. All of those persons have been claiming that they were at the scene, they were at the site at the time, though not very, very near to the event, but they got injured from the debris and whatever was flying about. So it's still evolving. Well, we are certainly hoping that all works well, but sometimes we know that if persons are highly critically injured, that we may have some unfavorable outcomes. We're hoping that doesn't happen, but the possibility exists. So we'd like to make patients and relatives. But we are definitely highly St. Jude community. The whole health team needs to be commended. You know, like they won. Moving the patients around and taking persons to theater and back, etc. And whilst we were doing this, of course, we had to see about the families, make them comfortable, see about the staff, because the staff, I mean, needed some replenishment as well, and I'm sure you know how they got that. So we're grateful for this as well. So the situation unfolds, and we will certainly give more updates as they become available.
Just before we go to the question and answer segment, in addition to the physical care and attention, persons have also received counseling. Would the NEMO director speak to that a little bit, please?
We do know the psychological impacts of such events on individuals, and as of today, the Department of the Public Service has offered such assistance through the Employee Assistance Program for families of the persons who were involved in the incident. The Department of Human Services have also offered counseling services. In fact, that department has started that process. They have seen one family last night. They saw one family, and today they are meeting with another family. They have also liaised with the company, and they have agreed that they will arrange for group debriefing. The company will indicate when that can be done. So things are being done in that regard in terms of providing assistance to the families of persons involved in that incident.
Okay, so it's a press conference, and it is really for you, the members of the press, to have this opportunity to get some answers. And I say some answers because you can appreciate this is still an evolving, developing incident. Investigations are being done at several levels with the police, the more pertinent responses that you need, but we do ask that you bear with us as the investigations continue in that regard. So any questions from the floor?
Good afternoon.
Good evening.
This question is directed at Dr. Fredericks. I know it is still early, just a few hours after the incident, but what would be some of the environmental and health concerns, at least from the Ministry of Health standpoint, in light of the debris and rubble at this site?
Well, we know that occupational health and safety is definitely a priority, one of the priority areas for the Ministry of Health. And the Ministry of Health, but also I think the Ministry of Labor also has jurisdiction in terms of occupational health and safety. So though it is early, I mean, we're still waiting on reports from fire, from police as to exactly what occurred. We are hearing many stories, but it may not be the exact situation. We do realize that the potential exists, that there may have been some concerns, and at some point, definitely I would expect the Ministry of Labor, which actually has this mandate, to go in, and of course health would be there as well on the team.
Thank you. Ms. Joseph, it's ironic that this incident happened mere hours after a tsunami exercise, and NEMO has undertaken several other simulation exercises. We've had oil spills and plane crashes, but this one, at least in my view, is the very first for St. Lucia. How do you see this informing future simulation exercises on NEMO's part?
Actually, it was in 2015, we did have a mass casualty training program in St. Lucia. We trained a number of community persons. There were a number of medical persons trained. And so it's not really a first, because we did have a small scale simulation as part of that training program. But going forward, I think it is one of the areas that we really need to pay more attention to. We have, as part of our portfolio, a mass crowd events portfolio. We do have one person manning that at the moment. We do have other persons trained in that area. And so we want to address the range of hazards that we're exposed to, and you will recognize that it's a broad range, and we try our best to address through simulation, through training, through public awareness, those issues concerned with those range of hazards.
One incident. First, I was referring to the type of incident.
The incident.
Yes. Thank you.
Jerry Georges, NBC Television. My question is directed at Mr. Milton DZ. The citizenry has been acting as judge and jury since the explosion, and many are questioning what is the protocol for storage of explosive devices. Can you speak to that?
Okay. There's, first of all, storage devices. It has to be stored. That is, if it is imported, you must first have an import permit from the Commissioner of Police, where storage has to be in the government storage facility, and that facility, well, it's in the Castries area, and this is when explosives are needed. they would be given on demand. So this is the procedure for storing explosive lawfully obtained in the island.
Thank you.
Been exposed to Mr. Joseph of the fire station. To this point, I know that you said your investigations are continuing, but can you share with caused the explosion?
At this stage, it is almost impossible for me to say exactly what caused the explosion. Like I said, the investigations are pretty, well, very much in its early stage. And I'm yet to get any report from my team on the ground. So along with the police, they are in the process of carrying out these investigations. As soon as we get, the information that is relevant to report to you, that will be done.
Any other questions from the floor? I have one question. Well, this incident was a mass casualty event, and it would have affected or challenged the resources of the hospital and even the fire service. You would have received additional calls. You would continue to receive additional calls even today. Can you give us an indication of the current status and what was that challenge like yesterday?
With this incident, as is the case in many other major incidents, off-duty personnel, upon hearing of these calls, respond to the scene. So up to last night, we had as many as 10 or so off-duty persons assisting the duty crew. Likewise, we have the fire officers from various stations backing up the responding station. So, for example, after Castries responded to the incident at Cul De Sac, Grosile Fire Station came down to Castries to provide backup.
Okay. What about the hospital, Dr. Frederick? Similar question in terms of how it makes it difficult for you to respond now, and is there any further needs? For example, during all times you always have requests for blood, but is there anything that you would like to current status and some of the needs that might be
Right, and as Officer Joseph indicated, we were actually having a discussion with some heads at the Ministry of Health this morning, like a simple debrief. And I think there was unanimous agreement that if Victoria Hospital and the health system had to be rated last night, it would have gotten an A+, because the teams really came together. Persons who were on board stayed on board, persons who were off duty came on board, all hands were on deck, public, private, clinical, non-clinical. It was really great teamwork, and we definitely commend them for this. And I think part of this has to do with certainly the whole nature of health, the fact that it's not necessarily something we do just for money. You need to have a love and a passion for it. And in addition to that, we have been getting training, disaster preparedness training, that very day. Earlier that day, we were involved in the tsunami simulation. You understand? So we were primed. Definitely, but when it comes to the blood aspect, all teams came on board. Thankfully, I'm not aware that we had any deficit in that aspect, but it's certainly a challenge with this situation and other similar situations where there's loss of blood and accidents, violence, etc. It is definitely putting a strain. It would certainly be a welcome event.
Thank you very much.
Yes.
Mr. Joseph?
I wish to add that the Red Cross also provided backup assistance to the fire service yesterday. So they were on scene as well.
In terms of personnel and the vehicle?
Personnel and the ambulances.
So with that, we've basically come to the end of this press conference. And again, we would continue to express sympathy to the families and solidarity with them as we all see how we can cope with this incident, which again, as they come very unexpected, but St. Lucia rose up to the challenge. We'll also like to express thanks to the government of Martinique, yet again has come to our assistance, neighbor in many ways to St. Lucia at this juncture as well. With that, we've basically come to the end of this press conference. As the developments unfold, as the investigations continue, to keep you updated and informed as to the latest on this incident. Thank you very much. I'm Richmond Felix.
The giant African snail, or the hibiscus pink mealybug, did not enter St. Lucia by accident. It was brought in by travelers from other countries. You can help save our agriculture